Don't rely on routine tests alone to protect yourself from cancer. It's just as important to listen to your body and notice anything that's different, odd, or unexplainable. Here are some signs that are commonly overlooked. Wheezing or shortness of breath. One of the first signs many lung cancer patients remembers noticing is the inability to catch their breath. Pain in the back or lower right side. Many cancer patients say this was the first sign of liver cancer. Breast cancer is also often diagnosed via back pain, which can occur when a breast tumor presses backward into the chest, or when cancer spreads to the spine or ribs. Did you know that cancer cells thrive in acidity? Cancer cells thrive in an acidic environment but cease to exist in alkaline environments. Frequent fevers or infections. These can be signs of leukemia, a cancer of the blood cells that starts in the bone marrow. Leukemia causes the marrow to produce abnormal white blood cells, sapping your body's infection-fighting capabilities. Difficulty swallowing. Trouble swallowing is most commonly associated with esophageal or throat cancer and is sometimes one of the first signs of lung cancer, too. Swollen lymph nodes or lumps on the neck, underarm, or groin. Enlarged lymph nodes indicate changes in the lymphatic system, which can be a sign of cancer. Excessive bruising or bleeding that doesn't stop. This symptom usually suggests something abnormal happening with the platelets and red blood cells, which can be a sign of leukemia. Over time, leukemia cells crowd out red blood cells and platelets, impairing your blood's ability to carry oxygen and clot. Unexplained weight loss. Weight loss is an early sign of colon and other digestive cancers. It's also a sign of cancer that spread to the liver, affecting your appetite and the ability of your body to rid itself of wastes. Weakness and fatigue. Generalized fatigue and weakness is a symptom of so many different kinds of cancer that you'll need to look at them in combination with other symptoms. But anytime you feel exhausted without explanation and it doesn't respond to getting more sleep, talk to your doctor. Bloating or abdominal weight gain. Women diagnosed with ovarian cancer overwhelmingly report unexplained abdominal bloating that came on fairly suddenly and continued on and off over a long period of time. Feeling full and unable to eat. This is another tip-off to ovarian cancer. Women say they have no appetite and can't eat, even when they haven't eaten for some time. Upset stomach or stomachache. Stomach cramps or frequent upset stomachs may indicate colorectal cancer.